We're ahead of schedule.
Commissioner, I had, this was just a letter, I'll just read it, so Commissioners CUNY and Kearns can hear this. Can you hear me fine, or?
No, I'm not over Deborah.
It's the way it always
Okay.
goes.
Okay.
Selling your house.
All right. Okay. Time out.
Oh, sorry,
Yeah.
I'm leaving.
Bye-bye. Say
See ya.
goodbye.
This is a letter to Lynn Fielding, who I can tell appears to be male. I wasn't sure at first, and I know some people here. Thank you for your letter of June 5th, 2020. The Board of Commissioners is closely monitoring our situation, considering the governor's May 31st, 2020 Safe Start Washington phase reopening county by county policy so that Spokane County may advance to phase 3 as soon as possible. Additionally, we are following various legal challenges in both federal and state courts to the governor's orders. The Board of County Commissioners has frequently contacted Governor Inslee's office with respect to reopening Spokane County as exhibited in the attached letters, which are 2 letters you have signed in the past. Likewise, we are aggressively monitoring the situation in our hospitals, among other circumstances, to advance to phase 3. Thank you for your concerns, and I've got sincerely Josh Kearns, Al French, and Mary Cooney.
So we did three letters in the past.
You had 3 letters, and I put 2 out. I was unaware of the 3rd one, and I thought the 3rd one, if you want that in, we can add that, Commissioner, was a little not necessarily on point because it talked about CDBG and some of that stuff, and I thought that might be confusing to him. What would he say to that? So that's, if you want 3 letters, we can put it in. I don't have any problems with that.
Well, so we did, I'm just trying to think back. We did one initially to open us up. We did one on construction once they were getting construction.
Yes.
And then another one right after the construction, Josh, that you put together that talked about different types.
Oh, yeah, it had a series of them. And then what are the 2 letters you have, Jim? Which 2 do you have?
One was dated May 6th, and the other was dated, or excuse me, April 6th, and the other was dated just last week that Gina showed me. I had not seen them before. Jack had told me there were 2 letters the other day, so Gina advised me there were 3, and so we got them April 29th, April 6th are the 2 that I proposed putting in there. In that they reflect the basic COVID things, the stay-at-home order, and also Commissioner's original thing relating to distancing practices and infra-security agency and cybersecurity, among other things. If you want 3 letters, I have no problem with that. It's just that I had been uninformed until about an hour ago that you have 3 letters. I frankly only thought there was 1, and Jack told me a couple days ago there were 2. So
Yeah,
that's.
But it almost seems like you got letters, but I'm not sure. I don't remember.
Yeah, and I understand, Commissioner, because Larry and I came forward at that other matter and suggested 2 possibilities. The April 21st was a construction one, but I really don't know that that one really applies now because I think we've pretty much done construction.
Right. It just shows our continual effort that we've done over the course of time to see the governor opening us up sooner.
Gina and I can put 3 there instead of 2, and that would be fine. As I say, I have no problems with that, if whatever your preference is.
So the question is, that we want to bless the letter and send it off?
sounds good.
So
I'm fine with it.
need a motion.
You want 2 or 3?
3 letters.
3 letters, okay?
Sure.
3 letters. We're gonna get to a motion here to authorize it.
Okay.
Yeah, move the drafting and signing of the letter as explained and read by Jim Kaufman, by the Board of County Commissioners at other than an open public meeting, and authorize the use of our stamps.
Second.
Motion and a second. Discussion. Seeing none. All in favor, say aye.
Aye.
Okay, there you go.
Thank you.
Commissioner Kathleen just showed up. Do you want her back here now?
Yep.
Okay.
Bring her on back.
I'll bring her back.
Come on back. Okay.
Miscellaneous real quick.
Real quick.
Aaron, out at the fair, has been tabulating some costs that they could possibly incur or have incurred because of the food distribution due to the COVID. And from May 15th, May 22nd, May 27th, June the 5th, and June the 12th, using our rental rate for parking lots and the forklift, totals $8,530 total. And I would just suggest that we turn that in for reimbursement. And that was all COVID related. That would not have been done without, or expenses incurred by the fairgrounds without the COVID.
Did you object? Okay.
No, I think on some of this, Gary, can you just be accumulating these costs?
Well, I'm funneling everything through Carrie, and I'd actually touched bases with Carrie on that issue, and she was concerned about the parking aspect of that being charged.
Okay, I guess
I had Aaron reach out to Carrie. They're discussing this. I told Aaron, you reach out to Kara. I'll ask the board if they would consider, if it's all good, obviously, that be for reimbursement. The forklift is a no-brainer because that was not only the equipment of one of our troops. And I would be surprised, I guess, if we couldn't charge on the parking lots.
I guess I just feel like we shouldn't have to, like, costs incurred for general government that is COVID related, you know, are getting accumulated at the auditor's office, and that, you know, we would just do, you know, could see like a list or something, you know, but I don't feel like we have to approve every one of them, do we?
I don't think so.
I don't either.
One, it's cumbersome for staff, but the other thing is it just consumes time for us on things that are kind of pretty straightforward, no-brainers.
Right. That's kind of what I think. I mean, the general government, you know, costs related to COVID that we just need to, you know, make sure we're identifying and tracking so we can reimburse ourselves.
Okay, perfect. Thank you.
Thank you.
Gary, I'm going to forward this to you.
Yeah, I mean, if it gets past Gary and
Harry.
Harry, I mean, who's going to argue with the two of them?
That's right.
All right. Very good. So Kathleen, you're here. You're going to do great things.
I'm gonna try to talk through this mask. It's not easy, but hopefully you can hear me. So yes, I'm Kathleen Terrell with Community Services, Housing, and Community Development, and we wanted to cover two different items related to our Counseling and Recovery Services Division, known as CARES. And so I'm hoping, because we started a little bit early, I'm hoping that Laura Schultz might be on as well too, our Fiscal Operations Manager, in case you have any fiscal questions related to this that I can't answer. So the first item that we wanted to discuss is the memo related to CARES transfer request regarding operating reserves. So this is actually a follow-up meeting with you from our April 29th, 2019 meeting with you regarding funding. If you recall, we were back in April 29th of 2019, we requested the Board of County Commissioners transfer $732,074 to our CARES fund account from the general fund. And this was because, if you remember, prior to that, in December of 2018, that same amount was transferred from the Fund 145 to the general fund because we had to close that Fund 145 in 2018. And so the board kindly, graciously approved that request, and we were provided with that funding. When we were provided with that funding, the Board of County Commissioners directed our staff to evaluate the future need for a 7-month operating reserve for our CARES division and do so during the first quarter of 2020. And so this is a meeting based on that follow-up request that you had. So we have recently performed that evaluation of our CARES division's funding and fund balances for 2019 and 20, which you have a copy of in handout A. And if you look at that, in 2019, the beginning fund balance and actually I'm going to read you the ending balance for 2019 is $2,037,535. And then if you look at calendar year 2020's budget for the CARES division, it's the same amount at the beginning, and then at the end, and this is what we're forecasting with our revenues and expenditures, to have $2 million, a little over $2 million. So based on our evaluation of our fund account balances and a review of our operating reserves and knowing what we would need them for, we are making the request to transfer back to the general fund $382,074 of the original $732,074, and allow the CARES division to keep $350,000 of the original total amount. And if you look again at attachment A, at the bottom of page 2 of the 2020 budget, if you go to the line item right above the total expenditures, you'll see where we have a line item there to return the reserve amount that we are requesting to the general fund of $382,074. And if we do so, that will leave our fund ending year fund balance at $2,085,143, which is fairly comparable to the 2019 balance. And so part of some of the reason behind that is, if you can see, with the $2 million, if you look at the different funding sources, Medicaid, HARPS, diversion, and so on across there, except for other, we can only use that funding for very specific purposes, which are not, which usually only a percentage for admin. And some of the reserve concerns, operating reserve concerns that we have are enumerated at the bottom of the memo. But there are things like we're still working with COVID-19, and we know there's going to be post-traumatic impact as well as impact still going on. And we have been advised by the healthcare authority to expect a real spike with regards to behavioral health needs in fall and winter. And so we want to be careful of that and have reserves for that. We are also aware with the total compensation study that there may be an increased salary there. Also, non-Medicaid individual service costs due to retroactive loss of Medicaid coverage that this division has to be sensitive to. Contract changes, which are quite often with regards to billing and our electronic health record system requirements. Late payments by the MCOs. We also have a fleet of 17 vehicles that we have to maintain and replace, and we usually buy them used, and we just had one go out, in fact. So a lot of vehicle replacement to make sure that we have the vehicles for being able to move and transport the individuals that are served by this division. And probably the most concerning is that the MCOs and the healthcare authority are looking at a value-based model in 2021, and we don't know what that's going to mean to us financially. So we feel confident at this point in time, if we retain that $350,000 operating reserve, that we should be pretty secure from that standpoint. So I turn over to the commissioners if you have any questions regarding this request.
Any questions? Harry?
So I guess just trying to make sure that I understand this correctly. I'm sorry, because I haven't looked at it prior to this. So you've got a $300,000, basically net income on that fund, and you want to transfer it back because you have enough fund balance to take care of the things you need.
Yeah. It's our position, if we retain $350,000 of the total amount, then that we forecast we should be fine with that.
Okay.
And return the difference.
Gary, thoughts?
Yeah, Gary. What's that, Gary?
No, that makes a lot of sense, what she's saying in terms of using the reserves and being able to put back $300,000 into the general fund.
Okay.
Sorry, did I miss that question?
Okay.
I'm fine with it then.
Mm-hmm.
And so if you approve what I've been advised is that there won't be a resolution from you for it, but instead that the process is the transfer will come from the chief budget office, the central budget office.
If that's fine with the commissioners.
Yeah, I don't think,
That's
yeah,
the
we're
typical
good.
practice from what I was advised.
Yeah, I think we're good. Okay. Next item.
So the second item is also a memo to all of you as well. And it's a request for the board to approve the CARES Division's plan for community behavioral health enhancement funds. You have in the past approved the behavioral health enhancement fund plans for the CARES Division. And this one's become necessary because of changes by the managed care organizations. And it's effective January 1st, 2020, but it's taken some time to get those requirements and changes from the managed care organizations, which is why we're bringing it to you at this time. As well as we went through the process of creating the plan, which I'm gonna hand off to Tanya in a few minutes to kind of walk you through the plan and the differences from previous plans that you've approved. But we also have taken it through with the union, the HR, who's approved it, as well as the union leadership. So you have a copy of the signed MOU from the unions, and that's handout number 5. So handout number 1 is the plan. And again, I'll have Tanya give you a brief update of some history on the funds for those of you that might not be familiar with it, and then explain the plan differences and take your questions.
Thank you. Well, and just a reminder, the commissioners, as Kathleen said, have approved our plans 3 times for a 6-month period. In 2018, under gross substitute Senate Bill 6032, the behavioral health organizations had a set amount that they were going to get for each 6-month period to distribute among the behavioral health providers. And there was 5 areas of focus at the time that they could be used for, which is included in the memo, but for sake of time, I won't go into that detail. So we did a multi-stakeholder groups that were required as part of the plan, and each agency had a designated set amount for each 6-month period. And it was based on their productivity, of the number of services they had provided, to try to find a fair way to distribute it. And the managed care organizations had to continue that plan for the first year, calendar year of 2019. So when we came to you in previous times to get approval of the plan, we had a set amount for each 6-month period, and we broke it out by strategy. Well, how it's changed now for 2019 under House Bill 1109, effective January 1st, 2020, the managed care organizations had to create new plans to submit to the Healthcare Authority for approval. And within the changes legislatively, the impact was they could only be used for one area of focus, which was the recruitment and retention of the behavioral health workforce. And the MCOs were required to incorporate these funds into increasing rates to enhance the community behavioral health. And so the strategy that the MCOs are doing to contract these funds is very different. And all 3 of them have a little bit of a different approach. We contract with AmeriGroup, Community Health Plan of Washington, and Molina. And what they're doing is they're going to complete a quarterly reconciliation after each quarter, and then that will determine what our amount is going to be. So we do not go into this knowing how much we're going to have each quarter. And for example, I can just share, we are now past mid-June, and we still don't have a quarterly reconciliation done with AmeriGroup because the data they sent us does not match our data. Plus, we only provide mental health services, and they have us listed as substance use disorder services, which is a lower rate. So that's a real issue. So what we worked on to try to figure out how to do a plan so that we're not going to have to come before the board 4 times a year, many months after the fact, is we created a methodology, and we did present this to our COO of the county before we took it before Human Resources and the union for consideration. So I don't know if you can pull up, it says attachment 1 for Commissioner Kearns and Commissioner CUNY. And so our methodology is obviously, historically, we would get about $150,000 annually for this division. Now it's to be determined. So the strategy of what our plan was is to continue the same areas of focus that we had previously, but we don't have a set amount. When we finally true up what those quarterly enhancement funds will be for all 3 MCOs, the plan is that we will play under training and development strategy 1 expenditures completely, which is the device data charges for the 22 Apple iPads that the clinicians utilize, as well as the Solo Protect ID badges for 22 clinical staff, which are a safety solution to reduce risk of personal safety because they're out in the community providing services to individuals with chronic and persistent mental disorder. And sometimes it's not even the individual you have to worry about. It may be who else is in the area, neighbors, family members. And once those expenditures are paid in full, and these have been traditional expenditures part of the plan, then 80% of what's left over would go towards the stipends, which is on the first page, and then 20% would go for the training stipends that we have provided to staff. And that will end up then expending 100% of the revenue. And just to kind of help give you context, compared to previously, how this was is about 17.6% of the total expenditures were for training and development, and 7% were for that training and development strategy 1. And then 75% was for stipends. And with this new model, what I estimated, if we come close to what we received previously, about 11% of these funds will be towards the training and development strategy 1 expenditures. 18% will be towards training development strategy 2 expenditures, and 71% would be on stipends. And if there's any questions, I know I've quickly went through this with you. I'd be more than happy to accept questions or feedback.
So this is Mary. So just is this similar to what we saw, and is this part of that same money that we saw for the jail stuff?
Yes, and for the jail, Commissioner CUNY, it's going to be very different because the enhancement funds for the jail come from the BHASO, and we do not have to contract it in the same manner that the MCOs have done it. So we will be continuing with being able to notify the providers in advance of the set amount they're getting as the BHASO. Unfortunately with CARES, because it comes from the managed care organizations, we have to follow the model that they decided upon and got approval with the healthcare authority.
Okay.
So the jail should not have the same complications that we're experiencing with CARES.
Okay, interesting. Okay, thank you.
You're welcome, Commissioner.
So are you looking for us to okay?
Yes, well, we do have it on the docket next Tuesday for a resolution for your signature and approval.
Okay.
But I just wanted to ensure there weren't any questions or concerns or changes you wanted us to make before this goes before the Board of County Commissioners next week.
Yeah, I guess just so the other commissioners knows, we've had these conversations in the past regarding some of this, and it's enhancements that you're given, and you use them the best way you can. So I appreciate all your efforts there. So thank you.
And Tanya, just what, if there's any feedback we get, a lot of this is meant for retention. And so the question then comes with the historical, is it working? And I'm just wondering what our turnover rates are. Are we retaining at a future date? It'd be interesting to understand.
Yeah, and I think, and some of this is a little bit complicated because of the delays.
I understand.
You know, and I think frustration, I understandably from the staff, although they understand the situation that we have been presented with and that we're doing everything we can and we're keeping them informed. And we've let them know they should never rely on this because at any time, you know, legislators can make a change, but we are doing our due diligence and, you know, trying to keep abreast of this.
And I think it's also further kind of complicated by the fact that there are 2 job class specs under the CARES division that have for many, many years been under what they should be paid. And we've been working with HR and talking to them about that. And they wanted to wait until after the total compensation study, which proved out that they were underfunded quite a bit for those positions. And so we are hoping that with that as well, and so are the employees. So we have lost some because they're frustrated because this has gone on for many years. So it's kind of complicated by that as well too. And so I think once we get a chance to address that I think then we will see some solid retention.
Understood.
Okay, any other questions? Okay. So, so you also have in the packet here, is this something you're going to brief on as House Bill 1590?
Yes.
Okay.
Thank you.
So I'm hoping that Tim Crowley, because we're running a lot early, I'm hoping he will be on. If he's not, I'll do my best to answer your questions and get back with you if you have any that I can't answer.
I can call him.
Okay. Or can we see if he's on?
Tim Crowley.
Timmy, you on there?
No.
But he's not on the
Okay.
phone.
He's right here, even
Oh,
better.
he's right in the room.
What else can I do for you?
Thank you.
That's
Just
that.
keep his name and
Your timing.
That's timing. That's timing. Good entrance.
Yeah.
Supreme Court has that kind of time. If they don't anymore.
Okay.
So thank you, commissioners. What I provided was a single handout, and it's a follow-up to the previous presentation that I gave on June 2nd on the House Bill 1590. And what I wanted to try to do is respond specifically to Commissioner Cooney's question. Hopefully it will be helpful to all of you. And Commissioner Cooney's question was, what would we recommend explicitly for the use of this funding? And it's really challenging, as you can appreciate as I share this information, for us to be able to do that. I can give you an example, which is what I did provide under 1A, option 1A. It's not necessarily what I recommend because I'm not an expert in this area. And what I'd like to do is talk a little bit about 1B. So what I provided in the document is an option 1 and option 2. There are multiple options that could occur. But I tried to zero in on these 2, and I'll kind of talk about maybe some of the variations with each of those that you could certainly look at. So the first option that I present is if you wanted to pass and vote on as a board on 1590 prior to September 30th, such that you would receive the full 0.1% sales tax revenue for in accordance with 1590. And again, would receive all of the revenue for all jurisdictions under Spokane County. And then I presented to show you an example of approximately 11 million, which is what we talked about. Let's say it was $11 million annually. What could it look like? And just provide it to you that there's going to be a certain amount of administrative costs that we would have to have. So I put that at an estimated 500,000. I put another example of you could use 1 million for the mental health crisis stabilization facility because you can have 10% of that in behavioral health. So that would be something that you could cover, for all the non-Medicaid type of operating expenses that might be under that facility, and that may save you having to charge agencies if that was something that you wanted to do. And then assuming that 9.5 million was left from that 11 million annual revenue, then what we were able to do is take costs and information from 2019-20's average per unit for affordable housing apartments of multifamily new construction. And we were able to estimate that you could do 43 affordable housing units at an average of 220,000 per unit cost. The other point I wanted to note, which you see in the notes, is you wouldn't even have to pass the whole 0.1%. It could be less. It could be subject to what the board wanted to do as well too. So
I didn't think that the Department of Revenue allowed you to do less than 1/10 of 1%.
well, we're assuming from the language in House Bill 1590 that you can, because it says at most.
Mhm.
So,
Then the cities can pick up the remainder if we don't take the full.
We don't take.
well, they definitely will, but I
Yeah.
think that you can. So the combination of everybody could come together at one
We
time.
should check
Okay,
it. though.
so the amalgamation of all the jurisdictions within the county could come to 1/10 of 1%, but the county by itself could not do 1/2 of 1/10 of 1% because they can't collect it. The challenge is, and I went through this with STA on our ballot measure when we were talking about going to 2/10 or 3/10, and we said, well, let's go to 2.5, and the state said, no, you can't do that.
Okay.
It's either 2 or 3.
Okay.
You can't do half.
Okay. So you could be correct on that, and you can also verify.
Where
that if
things
you
could
wanted
change,
this
I don't
to-
know, but
well,
it's worth pursuing.
yeah, it was just in the language. It was kind of
Yeah.
unusual language. John kind of brought it to our attention. We kind of evaluated it, and I checked it with Ron Arkels, and he felt the same way, that I guess it could be less, but
Yeah,
it may be just based on the cities taking their revenue. That might be
Right.
the interpretation for that.
Okay.
So we can check that. So really B is what would be probably our strongest recommendation to your question, Commissioner Cooney, and that is that really, if you really want to know where the greatest need and the demand is that we would recommend that one of the county commissioners as county leadership be able to be committed to wanting to take a leadership position on this, established with a task force or an affordable housing work group, putting it together to be able to have a needs assessment and really determine what are the needs of Spokane County, because sometimes they are not always the same as the city of Spokane. Sometimes our beneficiaries are served in a different way or have different needs. So that's why I hesitate to even propose something for your approval, is that it would be best served by a needs assessment. And then we identify different things that we would, again, recommend as part of this process. Again, that the leadership be by an elected county official, that you have a task force facilitator who is knowledgeable about affordable housing. And if that's not possible, then maybe when I refer to a local agency administrator, I'm really thinking of an executive, county executive leadership. Again, in that role, because this task force, we would recommend it be filled with, could be developers, community center leaders. It could be members of the HCD advisory committee, other elected officials that serve in the 12 cities and towns that make up the Spokane Urban County Consortium. So it's really kind of at that level of discussion is what we're thinking with regards to identifying the needs. And then to consult with Seattle and King County on what they've done, as well as with their levy successes. And then have you use subcommittees as needed to formulate this. I know that the time is short to be able to do all this, but again, if to really do it the right way, a lot of this more formal approach would be our recommendation, then be able to collect data on it to back up those needs. And then determine a short and long-term investment strategy potentially for this, and then draft a report based on this collected information, develop a public relations and communications plan, execute that. We recommend, especially if you're not going to do a vote with the public, go forward with a public comment period to collect feedback on that and to be able to get a gauge on the public support for it, and then vote on it. This would also give you the option if you didn't feel that you wanted to, that the support maybe wasn't there or wasn't clear, and you didn't want to vote as commissioners on it, you could still put it on the ballot and do it with a public vote. Obviously, based on our discussion last time, you wouldn't meet the September 30th timeframe, but when it did occur, you would be able to get what is available from the revenue standpoint, less any cities who act on it prior to September 30th. So that's really, I think our one reason why I think we recommend that the most is it's the most clearest way to be able to evaluate and obtain the needs of Spokane County versus an estimate without having that kind of feedback. Option two is, I know that your time is precious and you don't maybe have the time or energy to be able to lead that type of a task force to obtain that information. Another option would be to not do anything at this point and see what some of the cities and cities in Spokane County do. We know that the city of Spokane is very interested. We know that Ben Stucker was extremely interested when he was the president of city council. He put together affordable housing work group and did a lot of work with that, because a lot of this is also tied very similar to Substitute House Bill 1406. So, and in his absence, we know that Brian Beggs is now taken up that leadership role, not only as the president, but also very interested in 1590 and 1406 as well in affordable housing. So we also are aware that Brian Beggs is working with the task force, and is what we're hearing is that he's planning to make a case of councilmanic authority and approval of 1592 through the city. And that might be something that then the county commissioners could watch and observe and identify and get draw some conclusions from that with regards to public support as well. And then depending on that outcome of what the city of Spokane does, then the commissioners could decide to execute councilmanic authority prior to September 30th. Because we are hearing he's going to do this in the next couple of months, that he's not waiting until after, at least the last we've heard, he's not waiting until after September for this. He's working on it actively now. So you could wait, see that. You could decide based on what outcomes are given prior to September 30th, make a decision to vote on it. Or you could wait until afterwards, even after September 30th, vote on it after that, or again, put it up to public vote. And then just take the remaining revenues of what's left. Or if there's no public support for it, or you're not certain of that, you cannot vote on it at all. So probably B gives you the most options from that standpoint, without having to maybe do as much work involved with it. But again, what the city of Spokane might get from the affordable housing work group may or may not match exactly what would be the highest needs for Spokane County. It'd probably be relatively close, but it may not be exactly the same type of feedback you get if you went through option one.
So if the city of Spokane decided that they wanted to move forward with this, and they did adopt it councilmanically, then the sales tax would start to apply, I think April 1 of next year would be the next update of the tax.
I believe so. I
Yeah.
have to go back to my notes. It was either
Yeah.
March or April,
Yeah, I think it's April 1. But then the city of Spokane would have a sales tax level that's 1/10 of 1% higher than all the cities that surround it, right? So what do you think is going to happen to all those big ticket purchases that are currently happening inside the city of Spokane when all of a sudden they realize their competitors in the valley can sell their vehicles, whether they're RVs, boats, cars, at 1/10% less? What do you think they're going to do? They're going to move. They're going to follow the dollars. So be interesting to see whether the city actually does this to themselves or not. But your thoughts, what do you want to do?
So I actually didn't think of it from that angle that you just brought up, Al. I was thinking it more of looking at the state of our current economy. Just last week at the Workforce Development Council meeting, we received industry analysis, and using ESD's numbers here, the most recent ones that they presented to us at the Workforce Development Council meeting had Spokane County at 15.9% unemployment rate, and that puts us with a higher unemployment rate than Ferry, Stevens, and Pend Oreille County. I mean, I can't remember the last time that we had a higher unemployment rate than any of those three counties. And, a Spokesman Review article that came out, this was on June 4th. So about 2 weeks, just over 2 weeks ago. One of the last sentences, one of the last sentences in this this article is more than 80,000 workers in the county have filed unemployment claims since coronavirus pandemic forced closures of non-essential businesses statewide in March. I mean that and there could be some of the fraud, the fake claims that were filed as a part of that number, but there's a lot of people that are out of work. We're still seeing cases of folks that can't get their unemployment to go through, and I don't think it's appropriate to increase taxes at a time like this. The other claim out there too is, that sales tax is one of the most regressive taxes out there, and more than anybody, the person that harms most are those that can least afford it. So I don't feel comfortable increasing taxes right now, with what's going on in the world.
All right.
So yeah, I mean, it's a tough one. I mean, that's why I really wish that we could have just decided to put it to the vote of the people on a ballot. I mean, because, as we know, affordable housing is one of the biggest issues out there. I mean, I hear it from constituents. We hear it from the business community, all of that. So, I mean, so it's hard to also give up the opportunity to try to have a means of helping get more affordable housing. So I know if we choose not to do anything, the city of Spokane will. I mean, Brian has stated that I think they'll definitely do it. I don't know what the other cities will do, but I know it's a hard one for me, because it's like I don't want to raise taxes during the time where it's hard on people and people can't afford it. But I also know it is one of the issues that people talk about a lot is that we don't have affordable housing. We need more affordable housing. That's how we get more businesses here. We know we have no. I mean, there's still the vacancy rate is extremely low. So Tim, you see it from that perspective. I mean, as we look at this shelter, in the valley, that's a bridging, transition, place. And you still got to have a place to put people. Once you can help get them stable and on their own, got to have a place to put them. And so I don't know. I'm torn on it because of those reasons.
And I think the opportunity is there, that if you're not comfortable doing it now, there may be at a later time, a year out or wherever the case went. Obviously, you can't capture the full 1/10 of 1% if the city of Spokane goes forward and does what they do. You still could capture some of it at a later time if the economy recovers and you're comfortable with doing so. So I don't think not acting doesn't mean you won't get any of it in the future should the economy become improved and you feel comfortable doing so.
So what would happen if the board decided that we wanted to adopt the sales tax increase, but our action was subject to a ballot measure in November? And then then you put it on the ballot. If the voters say yay, then the voters were the ones that initiated it. And if they say nay, well, then you just get rid of the adoption.
I believe that we would need to get legal counsel's input on that, because I think that question was asked when I gave the update on June 2nd. And I think Ron Arkell said that that may not be allowed. I'm not sure.
Okay.
Right.
Yeah,
I
I'm
think-
pretty
I think we're
sure
already
he,
past that point, since we're past September 30th, and because the ballot measure would be after that, but the cities
Yeah.
would have the opportunity to go after it.
Okay.
yeah, but I think he said that's putting sort of like a contingency on it or so. I think he said we couldn't do that, if I
Okay.
remember correctly.
So then the other question is, so what's the definition of affordable housing in this? Is it,
It's the high definition, paying no more than 30% of their income towards housing costs. And
okay,
that's regardless of the tenure.
okay. So, and part of our challenge with affordable housing is, a big part of it is buildable land more than it is, revenue to cover the cost of it. I mean, $220,000 per unit. I mean, apartment builders are building apartments for that $70,000 to $75,000 a unit. So you're almost 3 times what the private sector can do in terms of cost. Is that a fairly accurate number?
I think so, yes. And that 220 was based on tax credit, 9% low-income
Yeah.
housing tax credit.
Yeah.
So, that there's a lot of upfront cost on that. Exception, and 220 is actually fairly low.
Yeah.
If you were able to bring in a unit at that, so.
So, but my understanding is it's not the cost as much as it is land, available land to build it on with the infrastructure in place. So I don't know, it's whatever you guys want to do. Jump in here anytime.
I told you where I'm at.
Yes, and I told you I'm not sure where I'm at.
Okay, so let's take this under advisement then, and we'll bring it back here in another week or two and figure it out. Okay,
Great. Thank you.
thank you for the update.
Sneak in there when you got a chance.
Okay,
Mr. Commission Chair, I have a memorandum of understanding between Spokane County JACT Foundation, Vision Marketing LLC, Spokane Valley Junior Soccer, China, and Wow China, they said, and Spokane Hoop Fest regarding some TPA things that were discussed by Mr. Driscoll. Handing you a proposed copy of the document, and copies were sent by Gina, I think about an hour ago, to Commissioners CUNY and Kearns. This was something that Mr. Maceo and Mr. Driscoll worked on. It is ready to go. There's also Visit Spokane and Visit Spokane Sports TPAs that are not quite as urgent, and I'm not quite sure some of the language where that's at, but I expect that will be ready by Monday. Mr. Driscoll or Mr. could have been here today. It probably would have been ready today. But this part will require other people to sign, whereas the others are just two-party agreements. So they should go pretty quickly. This will have to be circulated in a form, and will probably take a little bit longer time. So.
Oh, this looks like, I mean, it's the TPA dollar amounts reducing the amount to each of these organizations. Remember they, Visit Spokane and the Sports Commission came in a month and a half, 2 months ago or so, and needed to this looks like just another round of reductions, probably because that TPA amount collected has continued to come in lower than they even thought then, I would say.
That's my understanding, Commissioner Kearns.
Yeah.
so the recommendation is that we adopt this so that we can reduce the amount of the funding to each one of these agencies.
That's
That's
what.
it. That's it.
Yeah,
All right.
because the money's less.
Okay.
We have much choice.
Yeah, I mean, if the money's not there.
The intent here is that we're gonna spend less money. Yay!
Okay, so is this something we just do now, or is this something that'll go on a 2 p.m. consent agenda next week?
We're able to do it now. I've checked that out and we can proceed. Just would need a motion, Mr. Chair.
Okay. Mr. Chair, I move to approve this memorandum of understanding between Spokane County, Jacked Foundation, Vision Marketing LLC, Spokane Valley Junior Soccer Association, WOW China, and Spokane Hoop Fest Association, agreeing to the reduction of TPA funds awarded to those organizations.
I'll second the motion.
Okay, you've got a motion and a second. Any more discussion? Seeing none, all in favor say aye. Aye.
Aye.
The ayes have it. Okay. So,
Executive session, pending litigation.
yes, sure, why not? So it is now 4:01, and we are joined by Mr. Haskell and guests.